Hi everyone, happy Wednesday and hope you're doing well. Today we're going to be discussing seborrheic dermatitis, which is basically super excessive dandruff and itchy scalp, like almost addictively excessive dandruff and itchy scalp. But we'll give it a couple of minutes for Whitman-Walker to get into the space and for a few other folks to join us. But in the interim, during the COVID-19 pandemic, Whitman-Walker Health has expanded its outreach efforts to include the social media platform. We cover various topics about HIV and STIs, sexual health practices, social determinants of health, access to care, and public health interventions. The Whitman-Walker Health Community Health Team is here to educate. As soon as Instagram lets me accept the invitation. Okay, awesome. Well, okay, just wanted to make sure I was on Wi-Fi. So again, today we're going to be discussing seborrheic dermatitis, and this is super itchy scalp and dandruff. Hello, folks in the audience. Thanks for joining. My name is Jewel, and I use she, hers pronouns, and I work to bring educational Instagram lives to this space with Whitman-Walker's Community Health Team, and today we're going to discuss seborrheic dermatitis. Before we begin, if you're in need of HIV or STI testing, Whitman-Walker Health can help you out, and they have testing available by appointment, so please give them a call at 202-797-4439 to schedule an HIV or STI testing appointment. What is seborrheic dermatitis? It is a common skin condition that causes redness, scaly patches, and dandruff. It is a chronic form of eczema that most often affects the scalp. It can also develop on oily areas of the body like your face, upper chest, and back. This is also a condition that infants can develop, and when they do, it's called cradle cap, but it usually disappears within several weeks or several months. Also, shout out to healthline.com because a lot of this information is from them. They had an amazing article that kind of breaks down what seborrheic dermatitis is, so just wanted to shout out that source. So before I kind of get into the nitty-gritty of like treatment and like what to expect and stuff, I wanted to share some of my own experience with seborrheic dermatitis. So over spring of last year, I started to experience some of the itchiest scalp of my life. I would scratch obsessively and like wash my hair and apply oil just for the itch to come back practically momentarily, and for me to be like, wow, did I even wash my hair? Like, did anything actually happen? Did I just waste a handful of hours of my life for me to have no relief? But eventually these itchy areas started to have excess amounts of dandruff. So like I'd scratch away, I'd kind of clear the dandruff out, and it would kind of come back instantaneously. I'd put oil on it and it would come back instantaneously. So I kind of just figured like this was a new part of my hair journey as a person who is fairly new to have locks. I've mostly had like my natural hair out for a long time and now have locks. So I would try doing like baking soda and apple cider vinegar soaps for my locks, which is a pretty common thing that you do periodically to kind of cleanse your hair if it is locked. And I was hoping that this would relieve some of the itch that I was experiencing, but that also did not work. So in hopes of getting some relief, I finally started to Google and came across this term seborrheic dermatitis. And after that, I scheduled an appointment at the dermatologist because that's usually kind of the next step. So at the dermatologist prescribed me this ketoconazole hair oil and shampoo that I had to use a few times a week, which is the absolute worst because as a person with natural hair and locks, I had no business having to wet and dry my hair multiple times in 1 week. But this is the typical clinical treatment that you'll receive if you do have seborrheic dermatitis. You'll get this ketoconazole hair oil and shampoo, which is like a yeast treating hair oil and shampoo. There's also a cream available that they might prescribe you, but that's usually if the shampoo and the oil don't work. But I also didn't get that far in my treatment journey. That cream was pretty expensive, and like insurance doesn't really cover it. And when I say expensive, it was like $45 for a tub of it or a tube of it. But as someone who's been grateful and blessed to have really great insurance, that was kind of on the higher end of payments that I would be making for healthcare related pharmaceuticals. So all that said, none of this stuff helped my scalp. And shortly after, I learned that this condition can also cause you to lose your hair. So I knew I had to double down on my efforts to figure out what the solution for this problem was. So some of the causes of seborrheic dermatitis include it's kind of unknown, so doctors don't really know the exact cause of it, but they do believe there are some main factors that can contribute to the development of the condition. The first is the overproduction of oil. So an excess amount of oil in the skin might act as an irritant and cause your skin to become red and greasy. This may relate to hormone production as well. The second contributing factor is malassezia, and this is a type of yeast that naturally occurs in the skin's oils, but sometimes it can multiply more than usual and cause inflammatory responses in the skin, and so this triggers increased oil production, and excessive oil can lead to this condition called seborrheic dermatitis. Some of the risk factors, again, doctors aren't exactly sure why some people develop seborrheic dermatitis while others don't, but it does appear that your risk of developing this condition increases if a close family member has it, which from what I've learned, it seems like my dad has it, and he's like passed down to like my brothers. Me and my grandfather had it, and my like little nephews got it. So a lot of people in my family have been experiencing this. I just didn't know about it until it started happening to me. Other factors that are thought to increase the risk of seborrheic dermatitis include obesity and poor skin care and stress, environmental factors like pollution, the presence of other skin issues like acne, the use of certain skincare products, particularly those that are containing alcohol, certain medical conditions like HIV or Parkinson's disease, harsh detergents, soaps, and chemicals, cold and dry weather, medications including silorin, interferon, and lithium, and hormonal changes. And I also know that for myself, I had gotten off of birth control last year for a large part of the year, so I went through a series of different just like skin issues, and so maybe this also was one of the contributing factors for me. But some of the symptoms of seborrheic dermatitis that you'll see is that it commonly affects the scalp and the hairline, with symptoms ranging from mild dandruff to thick, dense patches of dried skin. Dandruff is a common characteristic of seborrheic dermatitis and can appear as fine, powdery pieces of dead skin. It might be visible in your hair or on dark clothing, and this is when it got both fun and embarrassing on my end. You're working really hard to remove your dandruff and scratch your scalp, and it can feel so invigorating until you see how many snowflakes of dandruff are falling from your scalp. But also, if you have more severe seborrheic dermatitis, you may experience erythematous plaques, and these are elevated solid patches of thick crusted skin on and around your scalp. If left untreated, the plaque could thicken and become yellow and greasy, and a secondary infection could also occur. So I wanted to share a few kind of community suggested treatments for seborrheic dermatitis. Personally, it wasn't until I found this trending post on Instagram of a woman showing off her severe experience with seborrheic dermatitis, and her sharing her experience and images of her scalp and like how inflamed and how much dandruff and like kind of just patches of dried dead skin she was experiencing. It wasn't until her sharing this that people started to be like, oh my gosh, I also have this. Oh my goodness, I have this condition as well. It's so embarrassing. Like, I don't know what to do about it. And so lots of folks who had, kind of gone through the motions of going to the dermatologist and getting prescribed the shampoo and the oil and seeing that it didn't work and then figuring out what to do from there, just troubleshooting different treatments, had all shared their recommendations in the comment section. And so from there, I kind of sifted through the comments and tried out a few of their products, and I'm happy to say that my scalp is in a much healthier, mostly dandruff-free and itch-free state. So if you are suffering from seborrheic dermatitis, here's some of the products that have worked for others and myself. So first off is using squalene or MCT oil on your scalp or affected areas, as they don't feed the malassezia yeast that might be over multiplying and causing the seborrheic dermatitis. Other oils will only make the itching and dandruff worse. So this makes sense as to why when I first started experiencing this crazy itchy scalp and this dandruff, that I would go and clear out the dandruff, apply oil, and it would just be just as itchy. I was basically feeding the thing that is causing my itchiness and my dandruff. So I got this squalene oil off of Amazon. It costs about $10 and is super great for other uses, from like skin and face oil to just body oil and whatnot. But super popular. I didn't know how great it was of an oil. You can also use a medicated shampoo. I've been using the Vanicream medicated dandruff shampoo. with maximum OTC strength with Prithian zinc of 2%. Here's what the bottle looks like. It's the one with the purple cap. I did buy the one without the purple cap and without the Prithian zinc, which is what's recommended to use, by accident the first time. So definitely check those both out. I also got this off of Amazon, and it was, I think I got it for like less than $9, but currently it's about $12. So just heads up there. And then finally, I most recently got The Ordinary's salicylic, I don't know how to pronounce that, acid, and I've been using it on my scalp for 2 times a week. It works as an exfoliator. It also has squalene oil and like I think a couple other oils in it, but it's really great. It's that you don't want to use it right after you've shampooed your hair because you've already kind of exfoliated your scalp, but it's good to use a couple times a week and just help it to kind of reset your scalp in ways. But yeah, I actually started using that last week, so it's pretty new, but I'm already loving the results and loving that I have not really seen any dandruff on my scalp, which is like, it's been a handful of months since I've experienced that I don't know what to call it, like that relief, that privilege of not having dandruff on my scalp after months and months of dealing with it. I think I first started to experience this in like April of last year. So yeah, and this costs about $7. You can get it from an Ulta Beauty. I think they might have it at Sephora, but I think they charge a little bit more for it at Sephora. But yeah, those are the nitty-gritty facts about seborrheic dermatitis and kind of what the community of folks on Instagram had to share in terms of how to treat it, since a lot of folks complain that the prescription stuff, these ketoconazole shampoos and oils did not work for them, myself included. So yeah, good luck if you're experiencing that. Thank you for taking some time to learn about seborrheic dermatitis. And before we go, we want to share a few reminders about HIV and STI prevention and testing services available through Whitman-Walker. You can learn about Whitman-Walker Health's testing hours and locations at www.whitman-walker.org/testing. HIV and STI testing are available by appointment at their locations. You can call 202-797-4439 to schedule your testing appointment, and be sure to check the website for the most up-to-date hours and locations. They're located, or the testing locations are located at Max Robinson Center at 2301 Martin Luther King Jr. Avenue Southeast in Anacostia, and the Whitman-Walker Health Center at 1525 14th Street Northwest near Logan Circle. If your community or organization is interested in the Whitman-Walker team providing mobile health services in your neighborhood, you can contact Mobile Health at whitman-walker.org, and you can also access HIV prevention tools like PrEP or PEP or Start HIV treatment with Whitman-Walker at their Max Robinson Center or their Whitman-Walker location on 14th Street. Thank you again to healthline.com for the amazing resource that they had that shared a whole bunch of information about seborrheic dermatitis. And of course, because we're in a couple of public health pandemics, before we go, we want to share a few reminders about COVID-19 and vaccines. If you've already gotten vaccinated, congratulations. You've taken a really important step towards helping yourself and your loved ones and your community not get sick from COVID. Multiple variants have soared across the world, and it's totally understandable if you want to keep wearing your mask indoors, as there aren't a whole bunch of measures in place to prevent people from exchanging, or just from like being in tight spaces that aren't well ventilated. We also know the vaccine is not 100% effective, and more contagious variants continue to spread. And there are just, again, few protocols in place to verify whether folks have been vaccinated or not. And again, tight spaces. It's winter, although it's 60-something degrees outside right now, and just being in unventilated spaces. So keep alert, get vaccinated, and if you have not been vaccinated, you're looking for an appointment, and Whitman-Walker is nearby you, you can call them at 202-207-2480 to make an appointment. If they're not nearby you or you're having trouble making an appointment with them and you're a DC resident, you can visit vaccinate.dc.gov or call 1-855-363-0333. If you're a Maryland resident, you can visit covidlink.maryland.gov or call 1-855-634-6829. And if you're a Virginia resident, you can visit vaccinate.virginia.gov or call 1-877-829-4682. If you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, social distancing, quarantining, and the like. It's very important that you consider getting the vaccine and discuss COVID precautionary measures with those who are around you. But also be mindful of masks and keep your distance, especially when you don't know whether a person's been vaccinated or not. And because we're in multiple public health pandemics at once, I want to also share some information about monkeypox. So according to the CDC, there are more than 29,000 cases of monkeypox documented in the U.S. If you are in DC, you can pre-register for a monkeypox vaccine appointment at preventmonkeypox.dc.gov. Virginia is working with local healthcare providers to contact, trace, and identify those who are most in need of the monkeypox vaccine. And the Maryland Health Department released a pre-registration system so you can register for a vaccine appointment. But no matter where you are, please visit your state's local health department for more information on how to register and get vaccinated against monkeypox. For DC, their welcome vaccine locations are first come, first serve and provide to eligible residents. Hours vary each day and by location, so again, you just want to visit preventmonkeypox.dc.gov for the latest information. And please remember to follow the Whitman-Walker family on Instagram, Facebook, and Twitter at Whitman-Walker, as well as their family accounts at RealTalkDC _ and at NoFilterDC. And if you need any more information or resources for health, Whitman-Walker's got you. Just give them a call at 202-797-4439. Thank you so much for your time and have a wonderful rest of your day. Happy Wednesday.